Today I'm going to walk through the contents and methodology of our ITS Bleeding Management Kit, which is our compact solution for treating the #1 cause of preventable death in the field, extremity hemorrhage, aka bleeding out. Let's get right into it. Okay, so the first thing you'll notice on our ITS Bleeding Management Kit is it comes in our proven ITS Nylon Zip Bag. These are durable, they're tough. We've used these for a long time. We've carried them in the ITS store. The dual handles are great, especially the little one-wrap strips denoting the medical contents with the red there. They're great for grabbing from either direction. And the breakaway security seal that we have placed on here ensure that when you're looking at this item in a desk drawer or wherever you have it, if it's in public view, you'll be able to know if it's been tampered with because the seal will be broken. It's almost like one of those fire extinguisher seals, so as soon as you grab the handle and pull the zipper, it's very easy to just cut it away. So if you need more of these, we do sell them individually if you do want to replace them, if you do have to use any of the components or you open it up for any reason. So once you open the kit, it will come with one of two tourniquets, so either the soft T wide like that or the cat tourniquet. And these are the latest generations of both of these tourniquets, and they will come inside. So in addition to the tourniquet, we've also included a pair of bandage shears, a pair of Nitrile Gloves, and these are in size large, which is the most common size, and most everybody can squeeze into these gloves, which is why we include that. We've got a little emergency space blanket. This is the new Quick Clot Bleeding Control dressing, so it's a rolled dressing, but it's for packing wounds, which I'll get into in just a second. We've got some official DHS Homeland Security instructions that they require to include with Stop the Bleed kits like this. We've also got the more civilian version of the Israeli dressing. It's called the emergency bandage, but it's still a 4-inch full-size Israeli dressing. It's just got a few changes, like different elastic, but it's still a very good, dependable dressing. And then also we include a little Sharpie marker or some kind of permanent marker that we'll include. Right now it's the Sharpie, but in the future, that's why I'm saying that. Anyway, so this is to write the time on a tourniquet. So once you apply the tourniquet as recommended in the instructions, and we do still include the tourniquet instructions with this. That's the cat instructions, soft T instructions are on the back of this tourniquet. So that's where that is, and the cat. So once you've applied a tourniquet, there is a place on both tourniquets, I'll show you on the soft T wide, to write the time that the tourniquet was applied. So either here or here on the cat, you can write that on the band that goes across it like this once you apply the tourniquet. So that's what the permanent marker is for. Then the bleeding control dressing and the pressure dressing are both to also stop that bleeding. So the purpose of this kit is, as I said, it's the #1 leading preventable cause of death. So that was established by the TCCC, the Tactical Committee on Combat Casualty Care, and that's now been applied to law enforcement, and now programs like Stop the Bleed are starting to recognize that it's important to have these components as well. So in addition to the tourniquet being your primary go-to source to stop the bleed, we've also got pressure control too. So a lot of capillary and venous bleeding, or capillary bleeding is very surface bleeding, venous bleeding as well as arterial bleeding both take a lot of pressure to stop, and sometimes an arterial bleed will not be able to be stopped with a traditional pressure dressing, so hence the tourniquet. So this has got a control bar in it. They call it a closure bar in this bandage, but it provides more direct pressure onto the wound itself if you're trying to stop the bleed. And then if the wound is severe enough, you may have to pack it with something like a hemostatic to stop the bleed itself. So that's why the bleeding control dressing is included. So this has kaolin in it. Quick Clot has that in it. It's a coagulant that stops or that helps stop the bleeding in that situation. So also includes some bandage shears if you have to get into clothing to actually locate the bleed to stop it. And then in all types of situations where there's blood loss, you could be dealing with, I think it's hypothermia or it's hyperthermia. Either one of those, you need a space blanket for it, I'm sorry. But that's the gist of the space blanket that is included in that. But basically the patient is getting cold because of blood loss and you have to keep them warm, and that's what the space blanket is for. So the thing about this to remember is that you've only got so much blood in your body, and the way that this kit was designed, it's designed to treat that #1 leading preventable cause of death, the traumatic bleeding. So normal adults have between 4 and 6 liters of blood in their body, and once you lose about 40%, once you go over that 40% threshold, it could be fatal. So that's why it's important to get the bleeding stopped, and it's important to have a kit like this readily available. So we use the zip bag too because it fits great in a desk drawer if you're in a school, or if you've got one of those defibrillator cases that's at your school, you can actually tuck this in next to it. I've seen a lot of that done in schools and public buildings as well. So that is the ITS Bleeding Management Kit. You can pick one up in the ITS store, store.itstactical.com.